whether we're talking the autonomic or the enteric. We don't have any innervation to the sigmoid colon or the rectum. There's permanent constriction, meaning feces will not pass. They get impacted, creates megacolon, big, okay, because you get this dilation. Abdominal distension usually takes place. Chronic constipation is definitely an issue. It can actually lead to life-threatening conditions, such as peritonitis. It can lead to gangrene of the colon, perforation of the bowel. They usually have to go in and use other measures to get feces out, whether surgical, mechanical, or whatever the case might be. Problem is, you know, for the lifespan of the infant and so forth, it's a definite problem. So these divisions that we have, we're going to look, you know, most at our sympathetic and parasympathetic, because the enteric pretty much is doing its own thing. So how is it that we're getting contrasting effects? How is it that sympathetic does one thing, parasympathetic does another, but at the same time, we're maintaining homeostasis? Well, because, for the most part, these systems do that, is the reason that we're maintaining homeostasis. Sympathetic and the parasympathetic, their neurotransmitters will be different. The receptors on the target cell become important. For example, norepinephrine, acetylcholine, all this sort of stuff. In the sympathetic division, which is excitatory, but I've mentioned it does what to GI? Inhibitory, and vice versa. The target cells on the organ determine what that tissue does, which is the case for almost all chemicals. You know, the receptor determines what's going to happen in that tissue, that cell. So, we're going to see that the role of these neurotransmitters is going to be huge in determining, is it excitatory or inhibitory? So, acetylcholine, we always tend to think of as being excitatory. In both divisions, acetylcholine is secreted by the preganglionic. We saw that represented in the little ganglia. Okay, we saw the ACH being present. Because ACH, acetylcholine, okay, they're going to call them cholinergic, choline. All right, so they're just termed cholinergic fibers for this system. If a receptor accepts it, they simply call it cholinergic receptor. So let's think about sympathetic versus parasympathetic, what it should excite, what it shouldn't. Okay? Now, the receptors, muscarinic, nicotinic. Well, nicotine makes you think of like nicotine, okay? Muscarinic, believe it or not, based on mushrooms, all right? So, if acetylcholine is supposed to be excitatory, and we're going to find receptors that can accept it, if a muscarinic receptor is present, look at what has these. Cardiac muscle, smooth muscle, gland. We're going to see excitatory or inhibitory. But now, look what happens if it's a nicotinic receptor. These are going to be post-ganglionic. Where do we see it? Adrenal. That's for our purposes right now, in the autonomic nervous system, the adrenal gland has the nicotinic. Everything else, muscarinic. Does that make sense? For the two receptors. So, receptors are going to be important in determining the response that the tissue shows. Norepinephrine, that comes from most of my sympathetic host neurons. You guys remember seeing the picture with it to the heart and NE being present? Well, norepinephrine, adrenaline, okay, these are adrenergic, adrenaline, okay? Receptors for this are called adrenergic. They have alpha and beta. Alpha is usually my excitatory, beta is usually my inhibitory. Once again, depending on the tissue, the receptor on the cell determines if it's excitatory or inhibitory. Now, the neurotransmitters, what do they do? Glands. Usually comes from what is the effect on the blood vessel going to the gland. We're going to find vasodilation, vasoconstriction, terms that we're going to get to know as we move into blood vessels. Well, if vaso, meaning vessel, dilate, if the vessels dilate, blood flow increased to that tissue, to that cell. So if I increased my blood flow, I increased everything that that cell needs to function. And in this case, if it was to secrete something, I have now increased the ability for secretion. Does that make sense? Constriction means we decreased blood flow, and I've now decreased the ability of those tissues. So, blood flow plays a huge part in what happens. And like I was saying before, when we move into the chapter on vessels, we're going to learn they're innervated. It's really interesting. I've mentioned quite a few times, sympathetic effects last longer because we make that norepinephrine, that adrenaline, the fiber goes directly to the adrenal medulla gland. And that product that's getting secreted, that product goes directly to the bloodstream. And that means makes its way to all cells of the body. And it has to actually be cleansed out of the body by the liver. So the effects last a lot longer. If a product that gets secreted, okay, if a product that gets secreted can be broken down right at the area of the synapse, the effect is much shorter. But when it gets into the bloodstream, it now has the ability to reach all tissues of the body before getting broken down and removed out of the body. So we're going to see that some of the substances that get released as neurotransmitters, they're going to help modulate. Now, what does it mean to modulate? Moderate, help, control, function. Okay, it's going to help it. So we have the fibers. Other stuff that gets that gets released can actually help the effect. We can see that it can also help by either stopping the acceptance on that cell or increasing it. For example, they're finding that our sympathetic fibers, they can secrete these other products like enkephalins, substance P's, neuropeptide Y, somatostatin, neurotensin, gonadotropin releasing hormone. They can release these other products that will actually, these would actually increase the effects of the sympathetic nervous system. So stuff like substance P, neuropeptide Y, those are going to actually help to decrease the function of the GI system, which is what the sympathetic division does. It decreases the GI system. Somatostatin is one that affects glucose. And one of the things we want to do is increase glucose levels with the sympathetic division. So their job is to hopefully increase the effects. Now, parasympathetic, all right, they help to release stuff like nitric oxide. Have y'all heard of that one lately? It's been more in research and topics and stuff than it has been previously, because we're recognizing what nitric oxide helps with. Not nitrous, like when you go to the dentist or whatever. This is nitric, something from our body. And what it does is it helps with vasodilation, helps to open or dilate those blood vessels, increasing the blood flow. It is actually the premise of the medications for penile erection problems. And this is what it does. The problem is, in the medications, it causes dilation throughout the entire body. Okay? Now, in cases where the body's going to have this naturally, it could be a case of where maybe there's some type of cardiac problem or something like that, and the body's trying to help those vessels. Some medications can be given to do this, to help dilate the blood vessels. People who may have angina attacks or something like that, to help with the pain and so forth. So if we look at these receptors, if we look at the neurotransmitters, parasympathetic, sympathetic, sympathetic, well, parasympathetic does its one thing. All right? Parasympathetic wants to calm the heart. It wants to calm the lungs. It wants to calm the blood pressure. It wants to make sure that the effects it has are calming effects. Constrict the pupils. But now in my sympathetic division, okay, sympathetic has to stimulate, sympathetic has to inhibit. So depending on what the target is on the cell determines what the cell's going to do based on the receptors that are present. A lot of what we know for the parasympathetic and sympathetic divisions, fibers pretty much innervate both. In other words, organs and stuff have both types of fibers. And we call this dual innervation because there's a fiber from parasympathetic and sympathetic. Yes, We have our